Metformin can be the right diabetes medicine and still create a vitamin problem that hides in plain sight. The issue is vitamin B12, a vitamin your body must absorb from food. It helps nerves send signals and helps blood cells carry oxygen. Low levels can mimic fatigue, aging, or diabetes nerve trouble. The drug may help blood sugar, while the vitamin gap grows. Metformin is often used because it lowers blood sugar without much weight gain. It also has a long safety record and low cost. Many patients keep taking it for years. The missing piece is not trust in the prescription. It is whether B12 is checked before every new symptom is filed under diabetes. Vitamin B12 is not just an energy vitamin. Red blood cells need it to develop normally, and nerves need it to stay protected. Metformin can make the gut absorb less of this vitamin. That means normal meals may not fully protect every long-term user. Absorption means moving a nutrient from the gut into the blood. With this vitamin, the process depends on stomach acid and the small intestine. Metformin may disturb those steps in some patients. A meal may contain the vitamin, yet less may reach the blood. That is why the first clue can be vague. A person may feel tired, foggy, unsteady, or notice tingling in the feet. Those symptoms do not prove deficiency. They are a reason to keep another cause on the table. A normal blood count can create false comfort. Anemia means too few healthy red blood cells. Low B12 can cause anemia, but nerves may suffer before anemia appears. Waiting for anemia can miss nerve changes that started earlier. The overlap with diabetes makes the problem harder. Neuropathy means nerve damage that can cause numbness, burning, tingling, or balance trouble. Diabetes can cause this by itself. Low B12 can create similar symptoms, so one label can hide another cause. A common mistake is treating every foot symptom as a sugar problem. Blood sugar may improve, yet the feet still tingle. That does not prove metformin caused the symptom. It means the medicine list, diet, and vitamin level all deserve attention. Better blood sugar numbers can make the B12 problem easier to miss. When the chart improves, people often assume the whole nerve problem is improving too. That can lower attention to separate causes. Meanwhile, the vitamin your nerves depend on may be falling slowly. Risk is not the same for every patient. Longer use and higher daily dose raise concern. Older age, stomach or bowel disease, and low intake of animal foods can raise it too. Long-term acid reducers can add another layer. The slow timeline hides the connection. A problem that appears after years rarely feels linked to the drug. It feels like aging, busy life, or diabetes progression. A familiar medicine can look unrelated to a new symptom. A stable routine can still be unsafe in one specific way. Blood sugar may improve while your nerves receive less of the vitamin. The safer mindset is not to stop the drug or ignore the vitamin. It is to keep the benefit while checking the risk. That is where risk sorting begins. One person recently started a low dose, eats animal foods, and has normal feeling in the feet. Another has years of use, tingling, acid reducers, and signs of anemia. Those situations should not need the same testing urgency. When risks stack, urgency rises. Start with years on metformin. Then add the dose, animal food intake, stomach surgery, bowel disease, and long-term acid reducers. Move faster when numbness, burning, balance changes, unexplained fatigue, or anemia appears. For routine care, bring 3 details. Bring how long you have used metformin, your daily dose, and symptoms in your feet, hands, balance, mouth, or energy level. Also mention vegan eating, stomach surgery, bowel disease, and long-term acid reducers. Those details help your clinician decide whether testing should happen soon. Use one direct request at the visit. Try this line: I take metformin long-term. Please check whether vitamin B12 testing makes sense for me. That is not self-diagnosis. It is a focused safety question your clinician can answer with your history, diet, and symptoms. The usual first lab step is a blood B12 level. Some clinicians also order a complete blood count, which checks red blood cells and hemoglobin. Hemoglobin is the oxygen-carrying protein inside those cells. If the result sits near the low range, your clinician may order a follow-up test. That test can show whether cells are acting short on this vitamin. Timing can change how a result looks. Tell your clinician if you already take B12, energy shots, or a multivitamin. Supplements can raise a blood level and blur the picture. That does not make testing useless. It means the result needs context. A normal result can still keep the visit honest. It can redirect attention toward other causes, such as blood sugar control, thyroid disease, alcohol use, or spine problems. A low result can point toward treatment or closer follow-up. Either result helps your clinician choose the next step. The reason for a low level changes treatment. Low intake means the body may not receive enough vitamin from meals. Poor absorption means the vitamin enters the gut but does not reach the blood well. The same low level can need a different treatment plan. Once the low level is confirmed, the question is not whether metformin failed. The question is how to correct the vitamin problem while keeping blood sugar controlled. Many patients can keep taking metformin while treatment starts. The goal is catching the deficiency before nerves suffer more. Food still matters, but it has limits. This vitamin is found mostly in animal foods, such as fish, meat, eggs, and dairy. Foods with added B12 can help some people. If absorption is the main problem, eating more vitamin-rich food may not fully solve it. That same logic applies to supplements. Do not let a store-bought supplement become the whole plan. Some people need a pill or dissolving tablet. Others may need injections, especially when absorption is poor. The right plan depends on symptoms, your test result, diet, and the cause. Treatment should have a clear follow-up plan. If treatment starts, ask which test result or symptom change should be expected. A plan without a clear goal can turn supplements into a habit with no medical purpose. If treatment is recommended, treat it as monitored care, not a sign that metformin is dangerous. The best outcome is simple. Blood sugar stays controlled, the low vitamin level is corrected, and nerve symptoms are caught early. After the plan is chosen, ask how often B12 should be rechecked. Long-term use should keep this vitamin on your care checklist. Your clinician may choose a schedule based on dose, years, symptoms, and past blood levels. Most cases can be handled through routine care, but worsening neurologic symptoms should not wait. Contact your clinician promptly for spreading numbness, increasing balance problems, new memory changes, or severe unexplained fatigue. Earlier assessment matters because nerve symptoms from vitamin B12 deficiency may become harder to reverse when treatment is delayed. Metformin can help blood sugar, but it can quietly lower the vitamin your nerves depend on. When the pattern fits, ask about B12, long use, higher dose, risk factors, or symptoms. The goal is not panic, it is to catch avoidable nerve trouble earlier. A checked level can guide safer follow-up before symptoms become harder to reverse. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.